Hello, parents. It is sadly one of the things we see a lot in our pediatric office is ear infections. So there is nothing worse than watching your child painfully tug on their ear, crying, and you're not able to do really anything about it. And after multiple rounds of antibiotics, they're still getting recurrent ear infections, either in both or even in just one, and then is the spiral to surgery and tubes, which sometimes work and sometimes don't. A short little list that we're going to talk about on some of the natural ways for your child to help heal from ear infections are neurologically focused chiropractic care, warm or cold compress, rest, vitamin D, and distraction, salt water, hydrogen peroxide, ginger, naturopathic ear drops, and changing sleep positions. Ear infections, especially the middle ear or otitis media, is extremely common in kiddos today. But some of those symptoms include fussiness, ear tugging, trouble sleeping, fever, and their fluid is not able to drain in their ear effectively. Neurologically focused chiropractic care comes in a couple different ways. So, the role of the eustachian tube for your little one's ears is it's a tiny canal that connects the middle ear to the back of their throat. And what is its job? To drain fluid and regulate pressure. Now, why this is important in kids is because at their age, this eustachian tube is more horizontal, which is why it's hard for this tube to drain fluid effectively. In adults, it becomes more slanted, which is why ear infections are more common in kids than adults. So where does the nervous system fit into something as simple as a tube? So when there is more tension and stress in this upper cervical part up here, it leads to tone and tension increases along all of the soft tissues and muscles in that upper neck area, including the tensor veli palatine muscle, which then gets too tight and wound up and limits that proper drainage through the eustachian tube. So this leaves when there's increased sympathetic tone within your child's nervous system, it can create a condition called dysautonomia, which leaves the body stuck in more of an inflammatory fight or flight state and weakens the immune response as a whole. So, if your child is more stuck in that sympathetic tone, this leaves the ear and immune system facing two main problems. It's unable to drain fully from the ears, which is in a pro inflammatory or weakened immune state. But the good news is that chiropractic adjustments, especially neurologically focused ones, help. I mean, in retrospective studies, it showed that 93% of kids with acute ear infections have improved after chiropractic care and have avoided tube surgery. Cold packs can help relieve the pain that are related to your child's ear infection. The warm heat can help relax the muscles around the ear, helping with drainage, and even if there's excess wax buildup. So, run a towel under hot water, but not obviously too hot that it's going to burn your child, and then wringing the towel out and gently lay it on top of the child's infected ear when they're lying on their side. After about 10 or 15 minutes, have them roll over to the infected, painful ear side down with the reheated warm compress on the bottom for 10 to 15 minutes as well in this position, allowing gravity to help drain the ear and wax buildup. Then another one is rest, vitamin D, and distraction. So, did you know that not getting enough vitamin D can help prevent ear infections as well? Now, in Alaska, that's a little difficult at certain times of the year. But while it may not seem directly related, boosting your child's immune system is a great way to prevent ear infections from occurring. So, rest is incredible with helping your child recover faster from an ear infection. In fact, if you struggle with sleep, it could be contributing to more than just ear infections. Sleep has been shown to help regulate blood sugar, behavior, and overall immune and digestive health. That is where your brain really works in that healing phase during sleep. Now, trying to distract them as best you can when they have an ear infection, such as reading, playing games, or watching a movie, can help take their mind off the pain and the recovery process easier for them. Gurgling salt water. So, most commonly, people use that for a sore throat, but also with saltwater gargling for ear infections, it simply helps everything drain at the back of the throat. Because remember, the eustachian tube starts in the middle ear and goes down into the throat for sinus fluid drainage. So, the little solution you should use is 1 teaspoon of salt and 1 cup of water. Make sure the water is warm but not too hot to avoid any burning sensation because no one wants a burnt roof of their mouth and tongue on top of an ear infection or a sore throat. So, hydrogen peroxide is a natural, inexpensive option for those looking to alleviate pain in their ear. So, people use have been using this for years, maybe even decades. I don't know. But it's still a very popular choice today. So, hydrogen peroxide releases oxygen in the ear canal, which helps remove earwax and debris. And it additionally helps kill bacteria and reduce inflammation, which can help alleviate ear pain. So, simply tilt their head to one side, add a few drops of hydrogen peroxide, let them know it's going to bubble so it doesn't freak them out, and allow it to stay in there for several minutes. Then tilt your head out to the other side and let it drain out. Now, it should not be used in a child's ear, though, if there's a ruptured eardrum. Now, garlic and ginger, outside of they are delicious things to put in your stir fries and food and meals at home. They are natural remedies as well to ease ear pain and discomfort. So, garlic has both antibiotic and pain relieving properties, making it a potential option for your child's ear infection. On top of, you can soak crushed garlic in warm olive oil for several minutes and apply a few drops into the affected ear canal, like hydrogen peroxide. Now, ginger, on the other hand, is anti inflammatory and it can help reduce and soothe pain easier. You can apply ginger juice around the outer ear canal, not in the ear, but around it to help ease potential discomfort. Now, naturopathic eardrops is another great option. So, many health food stores sell a mixture of garlic, ginger, and other naturopathic supplements, but they are all a little bit different as well. So, most brands contain a combination of garlic, ginger, or tea tree oil, mullein, lavender, vitamin E, olive oil, and other herbs. Colloidal silver is also another great option for ear infections in your child. Now, changing sleep positions. So, helping pick a sleep or laying position can be difficult, especially when they have to lay on it, but it can make a huge difference when it comes to ear infections. So, when it comes to that, sleeping on the ear without an ear infection or on their back can promote faster healing of the infected ear. Because sleeping on the infected ear can cause pressure to build up, exacerbating the pain and inflammation. On the other hand, sleeping on the unaffected ear or on their back can help remove some of that pressure that is building up in their infected ear, allowing for better airflow and faster healing. While this may not be doable for the entire night, because let's be real, everyone tosses and turns around in their sleep. If you don't wake up in the same position you fell asleep in, props to you. I am not that type of person. So, using this as a way to help your child get to sleep in a comfortable position can make all the difference. So, I hope you got some practical tips that you can use in your home for natural remedies when it comes to ear infections instead of relying on another cycle of antibiotics or surgery of tubes. Now, everything to get a hold of us will be linked down below, such as our social medias, our website. But if this resonated with you and you're not in Alaska, then there is a directory down at the bottom linking a whole directory of like minded chiropractors in your area, as well as share this video if there's anyone in your life with kids that have ear infection after ear infection after ear infection to prevent them, to give them some hope that they don't have to rely on all these things. Otherwise, thank you so much for tuning in. I hope you learned something and be well.